This presentation is about Mounjaro, uh, Ozempic, and weight loss. So, if you have had a visit with me already, you know a little bit about these things that I'm going to talk to you about today. But just to recap, what is the medication going to do for you? Mainly, the medication is going to work in your brain to block the hunger trigger. Another thing that's going to do for you is that's going to make you feel full after just a small meal. Um, it's also going to help you reduce inflammation in your body. So you're going to see probably less pain in your joints and things like that. It will help improve your energy and your metabolism. So when the medication is working and reducing your hunger, it's a time to start eating those reduced portions. Start training your body to get used to eating smaller portions. We want to stay in the negative calorie intake. You want to start building these habits to make them long lasting, right? So just like it took time for your stomach muscle to grow, we are going to train your stomach, your muscle memory to build these new habits and reduce the stomach size. Now, even though the medication is going to cut your hunger trigger, I still want you to eat 3 small meals. And I want you to go for the protein. I talked to you about this before, but why? It's huge, guys, with the protein. It boosts your metabolism. It burns calories for you. Your body is breaking down the protein and burning calories for you. So you're laying there just digesting a piece of chicken and it's burning calories for you. So you don't, it's another win for you, right? It will make you feel full longer periods of time. It will help you retain your muscle and help you build it as well, which is very important. As you lose weight, you can lose your muscle and your fat. So very important. Protein items. Boiled eggs are great in the morning. I I do boil 12 eggs at a time, and take two each day for your breakfast. Chicken and lean meats. And there is another thing with that a lot of my patients are doing is replacing your meals. For example, if you don't eat too much for breakfast or lunch, get one of those meal replacements. Ensure has, and many of them have meal replacements that are under 150 calories and 30 grams of protein. That's a good meal replacement for you, and that's probably all you're gonna need. A lot of times I have one of those shakes and I'm full after. I don't even finish it. So that is a great option. I am going to ask you probably every visit about empty calories. What are your empty calories? Have you had any today? You need to know what they are. Your rice, your bread, your potatoes, and pasta. Those are 4 things that you need to remember. So if you're looking at what you're about to put in your stomach, what are you about to eat, and it's an empty calorie, I want you to think about it. Do I rather eat this bread that's going to do nothing for me, or do I go for my chicken first, because you're already not eating enough? So make those small meals that you're having nutritious meals. I hear a lot of people tell me they don't eat breakfast, and that's fine. I had a hard time eating breakfast myself, and that's okay. But if you also tell me that you're eating late at night, or you're having to snack at night, then we need to reconsider and start eating. Um, adding something in the morning. so that you're not so hungry at night. Maybe it's another habit that we need to break, you know. Some people are okay, they're not eating past 6 or 7. That's fine. You don't need to eat your breakfast. Um, a couple things that I want to talk about with intermittent fasting and cheat days. With intermittent fasting, it is great. I love doing this, but not because you skipped your breakfast or your lunch and now you're about to break your fast, you're allowed to eat those 3 meals again, or anything that you can find in your path, you know, anything that you can get your hands on. No, it's supposed to just you're supposed to just have that one meal that you're having. So no, it's not. I'm gonna fast and then eat anything that I want. That's not what intermittent fasting is. The other one is the cheat days. No such thing. I think that if you're gonna have a hamburger on a Saturday, have it, but what I wanna see is that you're gonna have a reduced portion, a smaller portion than your normal size. We wanna look at the 7 day calorie intake, not one day 1,000 calories. You're going to ruin it for the rest of the week. Side effects. This is huge. Um, Nausea is one of the side effects that I try to avoid by starting with the small dosages like the 2.5 milligrams, right, or the 25 units. If I start you off with 75 units, usually you're going to feel very nauseous. Um, Another thing is you gotta pay attention to your body, because many of my patients tell me the nausea is coming in and they're also telling me, oh, I didn't eat anything today. Well, you're supposed to have something, right? Small meals, small snacks throughout the day. Or you're eating too much, too many carbs, and you didn't realize that. And next thing you know, you're like, oh goodness, I'm nauseous. Um, Another thing with you eating reduced amounts or reduced portions is and also your stomach being empty for a longer period of time, is you might have a little bit of acid reflux. So please take some Pepsid. Pepsid, it's okay to take every day. You're gonna be fine. And also pay attention to the foods that might be not sitting so well for you. The dairy, the gluten, they might be the ones that are causing you nausea or diarrhea as well. Mounjaro and Ozempic, these medications both work in the gut. So most of the side effects that I'm looking for is a little bit of diarrhea and constipation. Again, depending on what you eat is what you're gonna see either one of those. If you're finding yourself straining in the bathroom with constipation, I need you to take a laxative. Take Colace, Ducolax, things that they have over the counter. But if you're having to go every 2, 3 days without straining, it might just be the medication that is slowing your gut. Um, and if you have to also take, if you're having too much diarrhea, maybe take, I don't think you're going to have too much diarrhea. What is too much diarrhea? More than 4 times going to a bathroom and have a diarrhea, lose watery stools for more than 3 times a day. Okay. If that's the case, then you need to let me know. Something else might be going on. The big one is abdominal pain. This is important. A lot. This is part of the reason why I ask you guys if you had any history of gallbladder disease or pancreatitis or acid reflux. A lot of people have gallbladder disease and they don't know it because they never had an ultrasound of their abdomen. However, if you're somebody that has had problems before after eating certain meals, especially like if you eat something fatty and it makes your stomach flare up a little bit, maybe you have had maybe you have had gallbladder and we are not treating it. So if you are experiencing worsening abdominal pain than normal, you need to let me know, and maybe we need to send you for an abdominal ultrasound. Pancreatitis, very uncommon. I don't see this often. I haven't seen it in any of my patients. If you have had history of pancreatitis, I would not recommend, I would not give you this medication to start off. Um, but you will see again severe abdominal pain and acid reflux again because your stomach is empty for longer periods of time. The last points I would tell you about weight loss is studies have been done. We know that if you want to lose weight, we gotta target your diet. 90% of weight loss comes from your diet and 10% from your exercise. One more thing about the diet and the protein. One of the biggest things that reasons I check your blood work is to see that you don't have problems with your kidneys or your liver, and so you can eat a high protein diet. Okay, so uh, once you have lost about 10 or 20 pounds, then it's probably when I'm going to ask you, maybe start adding any sort of exercise, start building a habit, whatever it is, guys, yoga, tennis, Pilates. I love resistance training. You're gonna need this. If you're anywhere in your 30s, 40s, your body is gonna need it. You're gonna lower your risk for osteoporosis, lower the risk for joint pains, knee pain, or back pain. If you do a little bit of exercise, it's just gonna help you the rest of your life. And it's just something that you have to add to your routine. Now, keeping the weight off. Guys, even people that had bariatric surgery, I mean, they have gained their weight back. This medication, if you go back to your uh, bad habits, or if um, something major changes with you, with your health, you can gain the weight back. Nothing says that you're not. But that's why we want, I say we gotta start looking at what are the foods that you want to incorporate every day? What is attainable for you to have every day and continue the rest of your life? Um, this medication, what I want to see is 6 months of medical assistance for you to lose the weight. Most of my patients reach their goals 30, 40 pounds within the first 3, 4 months. If at 6 months, if after 4 months, we should look at start tapering it down. So if you are at the 75 units or 7.5 milligrams of Mounjaro, then we need to maybe go back to 5 and then go back to 2.5 a week. And it might not need to be every week. Some of my patients are able to last 2 weeks without the medicine, 3 weeks, um, any, but I want you to consistently stay on it for at least 6 months to 8 months, so that the gain doesn't, so that you don't gain this weight back. Your body, if you stop after 3, 4 months and you lost 15 pounds, 20 pounds, your body is gonna want to gain this weight back. It's gonna say, it's gonna go in a starvation mode. It's gonna try to gain this weight back, and you're gonna gain some more on top of that. Um, so that's why, in my conversations with you, I try to tell you, listen, that's at least I want you to stay on it for 6 months. And you don't have to do, again, the medication every week. At some point, we want to start reducing how much and how often. And that's it for you guys. You can always call me for any questions.